All right, welcome everyone back to another episode of CRNA School Prep Academy podcast. I'm your host, Jenny Fennell, and today we have a very special guest, Richard Wilson, who is also CSBA's expert contributor. Welcome, Richard.
Thank you, Jenny. Good to be here. Glad to be a part of this and looking forward to today's episode.
Yeah, me too. So today, you guys, this episode is going to be really fun. So we're going to talk about why it takes more than just being a good nurse to make you successful in clinical as an SRNA. So I am super excited to bring you this topic today. We recently surveyed our Facebook community, which is ICU Dreaming About Anesthesia. If you're not a member, go over and find it now. It's a really excellent resource and community to be a part of. However, I surveyed just to kind of see what kind of topics you guys wanted to hear about. And a lot of you had said you want to know how to be successful in clinical as an SRNA. So let's go ahead and get into it. And Richard, let's kind of start with let's kind of back up a little bit and kind of start with the ICU preparation and how it takes more than just being a good nurse to transition into the role of an SRNA.
So I love this topic here. I love talking about how can we set you up from the beginning, Jenny, to be successful as you get into anesthesia school and all through anesthesia school. And I can tell you as a program administrator, I can't tell you how many times people have come to us, whether it's been physicians, managers, friends, colleagues, all, and just say, hey, you know, nurse so-and-so is a great nurse. I think they need to be in anesthesia school. And I think, you know, they would do a wonderful job. And, you know, sometimes that works out and sometimes it doesn't, because it really depends on multiple factors. And that's why, you know, as you were talking about, it just takes more than just a good nurse to be successful in anesthesia school. It takes a lot of determination. You talk about grit all the time, and that's a wonderful term to use. There's a lot of grit that's involved with it. And most people, you know, think about that and they say, well, once I get into school, then I'm gonna be ready to go. But all of that starts way before you get into nurse anesthesia school. All that preparation, all of the things that you do in the ICUs, and even honestly, as you go back to nursing school and doing your clinicals at nursing school, there's so much that goes into all of that that leads you into being successful once you start nurse anesthesia programs. You know, I mentioned this a lot of times within the community, Jenny, and I mentioned this on several of the podcasts we've done before is, you know, the goal is to make you successful when you start school, because nurse anesthesia school is different than a lot of other programs across the nation in the fact that, you know, you don't complete a nurse practitioner program or you don't complete another master's level program, then you can really go apply to another school somewhere else and be okay. And in nurse anesthesia, it's different. If you don't make it through the first time you get in, unfortunately, there's not going to be another opportunity. And so that's why it's really important to maximize this from the beginning, even starting back as early as your nursing school days, but definitely in your clinical practice in the ICU, starting the foundation there, so that when you get into nurse anesthesia school, it's just building on that so that you can be successful.
Would you say it's more of a personality than, or I guess, what are your thoughts around that? Like maybe a go-getter or self-motivated?
Yep. So there's a lot to do with the personality and work ethic. I really think those are the two major things that you have to look at. A lot of people think it's really on the knowledge base that you have and that you can regurgitate or spit out medication dosages, pathophysiology. You can talk about the PA catheter and exactly what it does with the arterial line waveforms, the ABG analysis. And all of that is important. Don't get me wrong. You've got to have that background and you've got to have that base knowledge to really get into and be successful for anesthesia school. But a lot of people focus solely on that and they forget about the work ethic and the personality. And I'm going to be honest with you, there's a lot behind that. Work ethic and personality are huge in getting through anesthesia school and being successful. And the new term right now, and which is a hot term, and you know where I'm going, is emotional intelligence. All right. And that plays into your work ethic, into your personality. Emotional intelligence is huge. And there's so many studies out there right now that show that students or applicants or those that get into anesthesia school, let's say it that way, and have a high EI really are those that become the most successful and have the best chance of completing and being successful as a nurse anesthetist. So I think it really is a combination of work ethic and personality. Of course, you've got to have the knowledge base, because if you don't know what you're doing, that'll show. But those two things are huge.
And that's also why you guys, they assess this in your interview. A lot of schools are asking EQ, EI questions in your interview. What are some, like maybe some examples of how they assess this? And if someone was sitting here listening to this and was worried, like, oh no, what if I don't have good EQ? What, I guess, how can we explain this to people so they understand what to look for within themselves?
So great question. And for those that may not be familiar with EI or EQ, and you'll hear those two terms used interchangeably, it really is totally about, can you assess what's going on? And in the operating rooms, of course, with everything that we're doing, we have to assess every situation over and over and over again. And that's honestly some of the draw of going in and being a nurse anesthetist. And as I've read some of the books on EI, and it really is interesting to see and think about it, is most of the time we think about knowledge base and we think about it growing, but our emotional intelligence can grow also. We can build on it and we can make it better than it was last year, but it's something we got to work on, and something that we've got to focus on. And so really when they talk about EI, emotional intelligence, they're looking at self-awareness. In other words, can I see what my emotions are and how my emotions are playing into something, and how somebody else's emotions are, and what my responses need to be based on their emotions to get the best outcome of the situation that we're in. Because sometimes our knowledge base, and you've been practicing anesthesia long enough to see this, Jenny, sometimes our knowledge base has us and we know what the right answer is. We know exactly what needs to be done. But in that situation, that might not be the right answer. And that's what EI is all about, is can you assess and figure out what is the right answer at the right time in the moment to make sure you're getting the best outcome. So let's dive in, if you want to. Let's dive into a few questions that may come up on EI, or things to look for in EI. And most of these are personality-based questions, obviously, right? They're not the what is the receptors for norepinephrine or anything like that. It is the what is your strengths and what are your weaknesses? What is a situation in the ICU where you've disagreed with a physician or a fellow nurse colleague, and how did you resolve that? So these are the types of EI questions that you may see moving forward. Now, we did a recent, let's see, you and I did a recent live episode not too long ago, and we were doing some interview questions. And I asked the question, which questions do you feel more comfortable answering? Emotional intelligence questions or clinical-based questions? And I was honestly surprised that most people felt better asking or answering EI questions than clinical questions. And I figured out why.
Yeah, I want to hear this.
Clinical questions we feel are a hard yes, no answer. And it scares us because we're afraid that if we answer it in the least amount inaccurate, that the whole question is going to be answered wrong, and that people are going to feel like that we are just, uneducated in that topic and don't know anything. Where in EI, it's more of a feeling and a personality based. And look, I'm as guilty as anybody else. We love talking about ourselves and saying what we have, right? And feel better in that kind of a question base of it. However, the problem that occurs is when you've got faculty members who are very well trained in EI and EQ, and they're perceiving things that you never thought they were perceived before until you get feedback from them later on.
Yeah, those are all really great points. And I'd love to add that, talking about self-awareness and being able to read the situation, when you're in the operating room, you guys, you need to read the room, and not just read the room. You have to read your teammates, who you're working with, and how to handle talking and discussions. Sometimes these discussions are big discussions, or life and death discussions. They are make or break situations that are really going to affect the patient's outcome. So it can be very high pressure and very intense situations. And so when you take on this self-awareness on how you're coming across by asking or telling, asking for things, it takes that emotional intelligence to kind of be self-aware enough to say, how am I sounding? And how can I present this in a way that is more of an open-ended communication piece than a demand or something that could be taken offensively? So that's why it really comes into play how this unfolds in the operating room. And I also love to point out too, if you're wondering how to assess your own personality characteristics, I love to always point people to 16personalities.com because it's free. And it's a really great assessment tool to kind of pinpoint where your personality traits lie. And my only advice, if you take this quiz again at 16personalities.com, is to not pick neutral. Even if you are not sure, pick yes or no, or lean to the right or left a little bit more, because it'll give you more accurate results. But you have to be aware of these things going into it. And I also love, Richard, how you mentioned, you asked people whether they wanted, emotional intelligence questions or interview questions, and how that was very telling. And you also took time to think about, well, why did they ask this? And it's funny, because if you were to ask me, I would love black and white questions, because to me, gray area makes me uncomfortable, because maybe, and I had to assess this myself. Why is that, Jenny? Well, maybe because I'm not as confident in myself as I should be. And how can I address that confidence piece? So ask yourself that question that Richard asked these students. What do you feel more comfortable with? And then based on your answer, find out why that is, and then address it, because there's going to be a reason behind it. So all really great points. But what else can we kind of get into as far as when you say these programs are assessing you in ways that you may not realize? Let's kind of get into that a little bit.
So let's talk about that a little bit. And I tell you what, let's take that back to where we were centering around with the first question you asked, and the topic that we were talking about is, how do you take a good nurse and make them ready to be a great nurse anesthesia student, and even a great nurse anesthetist? And so some of those things that people are assessing when we're looking at the emotional intelligence type questions, which again, take it back into the ICUs, is teamwork, personality, edge, confidence. All of these things are looked at within the questions they ask on an EIEQ end. And they may ask one question, and unfortunately for you as a applicant, you're not being told exactly what they're assessing from it, right? You are assuming what they may be assessing, but you're not told. And it could be something different because you're in a stressful situation, and they had a completely different thought process behind the question that they asked. But it has to do with all of these characteristics that really will make you successful through school and in the field of nurse anesthesia. So again, we're looking at confidence. You want to be confident, but not arrogant. And some of that comes across in the ways that your communication is with your colleagues. And therefore, that is something you work on when you're with your colleagues. If you know that you're coming across arrogant or overconfident, you can work on that in the ICU. When you're talking to the new nurses that you're orienting, when you're talking to the experienced nurses, the residents, the attendings, the respiratory therapists, or anybody else that is involved, all of that is practicing the ICU for what you will be doing when you get into anesthesia school and have to communicate with the rest of the team. And you don't want to be overconfident, right? I know it's a kind of a gray area or a thin line, whatever you want to call it, but you've got to have that confidence in yourself and be able to show it. And that's one thing they're assessing. And you build that confidence in the ICU. Now, how do you build that confidence? I know that's a question that really should be asked, right? Because that's what some of this episode is how do we get to what we're talking about? Well, you become a great nurse and you build that confidence by, one, taking on those harder patients. Sometimes we want to shy away from them, but we need to take on those situations that we're uncomfortable with. Now, that's the hardest thing to do. It took me a long time before I really felt comfortable taking care of situations, whether it was a patient, a family member, a physician conversation, whatever it may be, that I was uncomfortable with. But that's only where true growth comes from, is when we get outside of our comfort zone.
Hey, future CRNA, a quick interruption because I want to personally take this moment to thank you for being loyal listeners of CRNA School Prep Academy podcast. It means the world to me. And I also want to share some exciting news with you that CRNA School Prep Academy has its 2-year memberversary right around the corner on February 26th of 2022. That means February of 2020 is when we launched CRNA School Prep Academy. Now, I could share a lot of backstory with all of this, but I hope you know that I have built CRNA School Prep Academy with you in mind, and it's a labor of love. I have always led with listening to my students, listening to you, what do you need? And I've tried my best to serve you in that way. And I really want to thank you from the sincerest, deepest part of my heart for just being with me in this journey. I'm sure if you've been around from the beginning, you've seen just how much we've changed and grown with you. And I have enjoyed every moment of it. I feel like it's so powerful, and kind of one of my reasons for why we do what we do is because I believe we are building a community of pay it forward CRNAs. That's you, my friend. You are a pay it forward CRNA. You have received mentorship from myself, from Richard, from the community. You know what it's like and how life-changing it can be to receive this type of advice, guidance, support along the way. And I know that you have it in your heart to do the same thing going forward to others. And so I want to take this moment and thank you. Thank you for finding that space in your heart. And thank you for going into this profession with mentorship in mind. And if you've been a part of our world for a while and you have not subscribed to our email list, I highly encourage you to do so. We can provide you support and guidance every step of the way. We also have an amazing Facebook community. It's called ICU Dreaming About Anesthesia. I highly encourage you to check it out. So again, if you're ready to join the Academy, I really hope to see you in there. Expert contributor Richard Wilson, who is our guest on the podcast today, is a part of our community. We do so much inside the community. We have live events, courses, educational offerings, and we're there for you. I go live every single week inside the social wall to help answer your questions, and Richard's there to answer your questions as well. We want to make sure that you have the support and guidance you need to make this dream a reality. So again, if you have not subscribed to our email list, the link to do that is in the show notes below. So you all have a wonderful day, and back to the show.
And start doing those things that we're uncomfortable with. We have a saying that we've always used in the academic setting I was in at our facility was start getting comfortable with being uncomfortable. Mm-hmm. Because we're going to grow and we're going to do so many different things that we're going to be uncomfortable as we go through this. And so that's how you grow in your confidence. That's how you grow in your skill set. Now, why do we not do that? Well, part of the reason we don't do that and get uncomfortable is because we don't want people to think we're idiots. Mm-hmm. We don't want people to look at us and say, I don't want Richard taking care of any of my family members because he's not comfortable here, right? He doesn't seem confident in what he's doing. And therefore, it prevents us from possibly growing further in the care that we provide and in our mindset of where we would be comfortable in an interview explaining some of that stuff. Yeah. So the confidence is part of it as we talk about it.
Yeah, these are all really great points. And I love the fact that maybe the reason why you're not putting yourself in these positions to experience growth is because you are afraid of not being good enough. And then it comes down to, it kind of brings me back to like the growth mindset, fixed mindset lecture, and really addressing that mindset, because that's what's keeping you stuck. That's what's limiting your growth, is being afraid of, well, why are you afraid of not being good enough? So ask yourself that. And is it okay to be wrong? Ask yourself that too. And it's funny when you talked about communication and confidence and how do you know if you are overly confident? I personally think a way to kind of assess that is also, it's one thing to speak your mind and let people know how you feel or what you want or what you think the patient needs, but is that open-ended? So are people able to rebuttal with you? And if so, if you're not overly confident, they're more than likely going to be able to rebuttal with you and not feel like they're too intimidated to do that. If you're overly confident, they might feel intimidated to rebuttal because the way you said it, presented it in a way that it's your road or not, like your way or no way kind of presentation. So your presentation on how you present things can really affect how people feel and their comfortable level to rebuttal with you. And so I think when you're overly confident, people can kind of see that as arrogance and, oh, I can't talk back to them because the way they said it wasn't such that they're right and I'm wrong. So maybe assess that a little bit, and how, if you've picked up on that, maybe from your preceptors or from nurses who are afraid to come to you. If people are afraid to come to you for advice, it's probably a good indication that you are too overly confident and potentially arrogant. And so people don't feel comfortable coming to you because, well, they're not going to have an open-ended discussion. So why would they come to you? Because you're going to just think that they're stupid. So they're afraid to talk to you. So think about that. How much do people come to you for advice in your unit? And then work on ways to make yourself more open to people having questions and maybe being wrong, and ask yourself, if you think mistakes are terrible, why are they so terrible? Kind of address that issue at its core.
Really, and to expand on that a little bit too, is talking about the discussion piece of that. That's what, again, you'll be working on in the ICUs to make yourself a better nurse and better applicant. But that's also what gets assessed within the interview process. Because when you look at a question like that that's asked about how has it been going with those that you precept,
Mm.
how is it when you speak with the nurses and how do they perceive you within the unit? And if you're able to kind of show them that you're able to have discussions with them, right? You've got teaching moments and you've got discussions and things that you may not have understood that you were able to recognize and talk with them about it. All of that, when it comes up in an interview, shows that, hey, this applicant I'm speaking to is going to be somebody we can teach, somebody that we can lead, somebody that we can mentor and make them into a great nurse anesthetist, because I'm already seeing those great characteristics as a nurse. Or it may be the other side of it where they say, coming across pretty strong here, seems a little arrogant. Probably when they get in, they're going to be hard to manage and they're going to be hard to teach because they're going to feel like they know more than every instructor that they get into, and within the clinical setting, because you got to be able to fit well in this clinical setting. And this is why, again, going back and saying great clinical nurses, great people that have great clinical practice are not always successful in an anesthesia program. And it has to do with that mentality of going back to learning and becoming trained by other people and having that open discussion, open conversation, and open mindset that, hey, they're helping me and I need to absorb this and take on an active learning process.
Yeah, being teachable is definitely a huge thing, and I've heard that said multiple times, multiple ways by various program faculty. And when you're in the clinical setting, you guys, the reality is sometimes your preceptor might not always be right. And how do you handle that? How do you handle when someone tells you something that you're like, but I just learned it and that's not accurate now? And you're going to probably face that quite often. And as a student, as someone who's learning, it's definitely a unique way to approach it, and in a way that's still very thankful and grateful that you're being taken under someone else's wing. But also keep in mind, there's 100 ways to provide anesthesia. And just because a textbook says one thing does not mean real practice necessarily unfolds that way. So it's having that open mindset that really says, well, let's just slow down a little bit before I jump down their throat and say, well, that's not accurate because I learned it this way, or I learned in this textbook it said this. Give them a chance to explain, why is that interesting? Can you tell me more? That automatically says two things: I'm interested in what you have to say, I'm being respectful, and I'm here to learn from you. And even if you don't agree, soak it in. You're a sponge. When you're a student, you're a sponge. You have to soak it all in and make up your mind how you're going to practice. You might not like their technique, but just embrace it. You're a student. Would you say that's pretty accurate?
That's right on. Emotional intelligence is all involved in that aspect right there. And I have to really guide a lot of our students on that, because that's one of the hardest things to go, is that you're learning the textbook, you're learning the material right there. You were just tested on it 2 days ago and you aced the exam. So you've got a good understanding of the knowledge base that topic is. However, in the clinical setting, as practice may be a little bit different. It becomes hard to understand and hard to really relate to. And so what I tell people is, just think about it. Is this going to affect the patient in any way? Is it going to provide patient harm? If it is going to cause patient harm, then yes, it may be something that you need to maybe stand up a little bit stronger for, or have a little bit of a deeper conversation. However, if it is something that you feel is a gray area, then it may be just like you said, hey, can you teach me? I want to learn more about it that way. I've not done it that way before. That sounds kind of interesting. And again, you may never ever do that technique again in your life, but it at least was a chance that you learned about it. And it opens up a great environment for learning, right? So you think about it in the ICUs, right? And again, we're going to go back to the ICUs and draw it into the nurse anesthesia programs. You go back to the ICUs, who are the nurses that really want to mentor you, right? Who are the physicians and the residents who really want to mentor you? It's the ones that you have those open conversations with and you listen to, and you take some of their knowledge. Again, you may not take all of their knowledge base, but you take some of their knowledge base and you recognize it and you say, hey, that was great. I enjoyed learning that. Now, again, they're going to come to you and find you more and more and more and try to teach you more. I had that happen with a physician when I was in the trauma ICU. Very well-known physician in our area, loved him, but he was a very hard individual. And, it was a trauma surgeon because he was good at what he did, He knew he was good at what he did. And one day I wanted to learn more, and something happened in the ICU. And I went up to him afterwards and I said, okay, we did all of this for this patient and the patient lived. That's great. But I want to know why we did that.
Mhm.
And from then on, he explained it to me. And from then on, when things happened, he would come find me and say, all right, let me tell you what's going on here. Let me tell you about this. And he would teach me. Well, that's not just resident and physicians that do that. That's nurses too,
Mhm.
and nurse anesthesia or nurse anesthetist.
Mhm.
So having that open mindset and just saying, hey, teach me a little bit more. Now, again, you may not agree with everything they say, but then you have to put it in the face of, is this going to cause patient harm? If it's not, then hey, no big deal. Let's move on. If it's going to cause patient harm, you might have to stand up a little bit for it. But again, this starts when you're in the ICUs, learning from all of those people that have been there before you
Mhm.
and having that mentality. And that just carries on. If you're doing that there, it's going to carry on and build as you get into the nurse anesthesia programs.
Yeah, I love it. And essentially, it's taking initiative for your own learning, and taking an active approach to seeking out opportunities to learn and not being fearful of asking questions. And um, I say this multiple times, but never be afraid to ask. You owe it to yourself and the patient to ask questions. And if anyone ever criticizes you for asking a question, they're the ones is wrong, not you. Like you need to ask questions, especially as a student, even as a CRNA. And part of that asking a question is taking initiative to learn, to embrace other knowledge. And so it's a good way to be. But I love that. And I think also it kind of ties into work ethic in a sense that if you're more willing and able to ask questions, you're willing to hear that you might have some work to do, right? To get the knowledge that you need.
So work ethic is a term that really some people don't understand. I think we think about work ethic and we think, how hard are we going to work, or how long are we going to work? How many hours are we going to put in? And we really say that somebody's got a strong work ethic if they're working 60 hours a week, possibly, right?
Mhm.
And things like that. You know, you hit it right on the head. Work ethic is about what you're going to put into it. The determination that you're going to put into this to learn it right, to learn it well, and to take better care of your patients. That work ethic is something that comes out strong in the ICUs. And again, it's found out with these EI questions and interviews. So if you're already doing or having a great work ethic in your ICUs of, I want to make myself better. I want to be a good team player overall. That work ethic is going to show in the interviews, and that's going to carry over into the clinical setting of a nurse anesthesia program. Because here's the thing about a work ethic and the thing about teamwork in the nurse anesthesia setting. We think of it, right, Jeannie, in the clinical setting as me and the physician and the surgical tech and the circulator within that room. However, I'm going to take it to a different level here in the clinical setting of a nurse anesthesia program. You and your classmates are a team,
Yeah.
and you won't get through that program without the rest of your team. Well, let me say this. You may get through it, but it's going to be a little bit more difficult if you're not using your team members, because somebody's going to do hearts before you, or pediatrics, or trauma, right? Somebody's going to have some intubations before you, or somebody's going to understand something a little bit better than you because of their background before they even came in. And so that's the work ethic team player mentality that needs to be in you. You learn it in the ICU, you practice it in the ICU so that it becomes second nature when you get into nurse anesthesia program, so that you can be successful through that. Because the rest of your classmates, whether it's the academic setting, which we'll do that episode another day, or whether it is the clinical setting, that is where you have to become a team and help each other out, not just, again, in the physical operating room, but overall with your clinical education.
Yeah. And I actually would like to venture and say that, again, it's not about the hours, it's about the work you put into the amount of work that you do. And when you're working 60 some plus hours a week, you're more likely to get burnt out. You're less likely to be a team player because you're burnt out. And so I encourage you, if that's happening to you, you need to be someone who doesn't just watch the clock, who just, when they do have downtime, sits and just plays on their phone. And trust me, if that plays and spills into the clinical realm as an SRNA, you're going to have major problems. No CRNA likes to work with another CRNA who's a clock watcher. It's just a known fact. And then I'm sorry, but if you get out of work early, the first thing you should be doing is, okay, yeah, you're going to leave work early. Great. But check on your coworkers, check on them for a bathroom break. If that's the kind of team player mentality you have now, it'll spill into your time as a CRNA, and your coworkers are going to love you because they know you will not just leave them high and dry. They know Jenny's going to check on me before she leaves work today. She's going to make sure I've been watered and fed, and she's not just going to leave me sit in this room. Like, again, this all plays into are you like that already in the ICU? Or when you have downtime, do you just waste it? Or do you go around and say, hey, do you need help with a turn? Do you need a bath? Do you need an IV? I have 15 minutes. Let me help you. And again, the more you're working, the less likely you might be willing to do those things if you're really running on fumes when you're going into work. And so that may be something you need to address if that's speaking to you. But essentially, there's no shortcuts. You have to being a team player means there's no shortcuts.
That is true. That is true. And also the thing is, you've got to understand about being a team player. This is one thing that I've always said. We never know when the time that we're going to need something is going to come about. And if I'm not a team player and I'm not looking out, as you said, looking out for my colleagues and restroom breaks, or even just seeing and going, hey, looks like you're struggling with this patient a little bit. Can I help you somehow? Can I tell you what, let me give them their bath. Let me hang these medications for you. Do you need to step out for 5 minutes? Because we all have those situations, right? And we don't know what everybody's going through, especially these days with the mental stress that's put on everybody, with patient loads, with COVID, with how sick our patients are, with maybe decisions that management has made that we're not happy with. It's just being that team player to say, hey, let me let you step out for a few minutes, or let me help you with this. And take advantage of that, right? Because eventually you're going to need that help at some point in time, or you're going to need somebody to step in for you at that point in time. And therefore, if you haven't been helping them and you get known as the one that is not helpful, then nobody's going to step up for you, right? Because word's going to be around. And I want to get into, I love the phrasing of stuff. And you know that, Jenny, we talk about that a good bit. To me, it's all about how you phrase it. It's the old adage, right? It's not what you say, it's how you say it. And it does make a big difference. I think we use that and don't understand what that really means. But me coming to you and saying, hey, can I help you? Do you need anything? Well, Jenny's very proud, right? Jenny's a strong worker. She doesn't want people to think she needs help with things, because it may come across to her that it's a sign of weakness if you ask for help, right? And therefore you say, no, I don't. And then you just you get deeper and deeper into the hole, right? However, if I come to you and say, I tell you what, I see that you got a lot going on. Let me hang that medication for you. Let me do this for you. Then what happens is Jenny says, okay, appreciate it. Thank you very much. And I've taken some stress off of you. You recognize that, and down the road, you turn around and do the same favor for me. So it's really all about how you phrase it.
I love that. And it's sometimes about kind of almost not just phrasing it, but knowing what someone else needs, right? And being aware and say, okay, well, I've done this type of case before. I know how hard it is to get set up for this room. Let me do this. Or I know that this is a challenge. Like, I know they're going to need lots of IV access. So instead of saying, hey, do you need help? Saying, hey, let me start your IV while you do the A line. Cool. Because now you already know what they need. And so going into a situation where you already know what they need is a great way to present it. And also, as an SRNA, I want to remind you guys, as a student, you do matter and you are capable of helping out. Maybe you don't feel that way because you're new, but you do matter. You can contribute. So don't be shy to offer help. And maybe you don't know, maybe you're not there yet as far as knowing exactly what someone needs, but I have SRNAs to come in my room sometimes and say, hey, would you mind if I helped you with the airway, or could I do the airway or do the IV? Or would you mind? Sometimes it's just, can I observe? And I love that because it shows initiative, and it shows that they're willing to put themselves in a place of uncomfortableness and learn and grow. And eventually what that turns into is knowing what people do need. And so when they do come in the room, they could say, I know how, in this type of case, you're going to need X, Y, and Z, so I can help with this. But you will never know that unless you start putting yourself in these positions and experimenting and trying. So if you have that same go-getter attitude while you're an ICU nurse, it'll just spill into your time as an SRNA. Oh, I think Richard froze on me. Are you there?
Yeah, I'm here.
Oh, okay.
Yeah, my internet's been a little bit here and there, but
oh, it's okay. So anyways, so I think, I mean, do you have anything else you want to add? Because I honestly think we really summed up all of this really great. And, you know, all of you that are listening, I know you are a good nurse. Me and Richard, we both know that. And that's why we're bringing this to you, not because we're trying to say, wow, being a good nurse is not enough, because it's not what we're saying. We're saying we know you're a good nurse. We want to make sure you understand what encompasses being a good nurse that will then spill into you getting into CRNA school and becoming a successful student in clinical. So we are just trying to point out attributes, action steps that you can start taking today to allow you to embrace the fact that you are a good nurse and you're going to be an amazing SRNA as well.
That is exactly right, Jenny. Being a good nurse is part of it. It's not all of it, but it is a big part of it. And then by adding, like we talked about, all these other characteristics on top of it, and your good nurses are going to have a lot of those characteristics. So that's what's going to make people successful. So that'll get you through the interview process and get you through anesthesia school so that you can be successful. I always tell people, there's a lot of things that go on with in the ICUs and within the nurse anesthesia programs that are stressful. But remember, that's a short-term investment for a long-term gain in something that you want to do for the rest of your life. Something I love, something I enjoy. And I thank you for having me on here today, and I enjoyed the conversation.
Yes. Thank you so much, Richard. And thank you all for listening and tuning in today. And we will see you next week.